Hello and welcome to shoulder pain education session delivered to you from Southport and Ormskirk NHS Trust and the Joint Health Department. First off, why am I here? Research shows that early advice with acute shoulder pain conditions can prevent longer term pain, and we know that most people with pain want to know a few things. What's wrong with me? How long will it take to get better? Is there anything I can do now to help myself at home? And is there anything that the medical professions can do to help with that issue? And we hope this presentation will help you answer most of these questions. And we'll touch on those as we go through, looking at a little bit of shoulder anatomy and how the shoulder moves and works, the possible diagnoses within the shoulder, talk a little bit around pain, and then what physiotherapy can do for you, and what exercise in that shoulder can do for you. Now, of course, we can't be really specific with your diagnoses because this is just a general information presentation. But if you are already aware of what your diagnosis is or have an idea, then it could be useful as well. So as I said, in today's session, we'll look a little bit over shoulder anatomy, causes of shoulder pain, the treatments that you can do before physiotherapy appointments, and strategies to manage shoulder pain more effectively pre and post appointment. What will happen after you are seen by one of our physiotherapists, the benefits of exercise and managing those setbacks. So as you can see here, we have a stripped back shoulder. The image on the left is an anterior view, so that's coming from the front towards the back, and then the image on the right is a posterior view looking from the back of a right shoulder there and looking forwards. This just gives you a general idea of the bony anatomy. So up the top you can see your clavicle or your collarbone, and then the big large irregular shaped flat bone is the scapula. The glenoid and the glenohumeral joint is the top of the arm, and then the humerus, of course, is the arm joint. Now, the shoulder itself is the most mobile joint in the body. It can move through 180 degrees of motion, and it has quite a complex network of muscles and tendons to make sure that the shoulder can stay functional, strong, and remain stable. So as you can see, this is an image of that complex muscular and tendinous network. And the most common thing that you probably hear about the shoulder is the rotator cuff. And the rotator cuff is a group of four muscles, which is the supraspinatus, the infraspinatus, the subscapularis, and the teres minor. And those muscles sit quite deep inside the shoulder joint. They have a role in stability, and they have a role in initiating movement. And then some of the muscles which are more towards the exterior aspect of the anatomy, like your deltoids, which are the bigger shoulder muscles you can see on the outside, your trapezius muscles, which make up part of your neck, and then the muscles around the back, like your deltoid and your latissimus dorsi. But the shoulder is quite complex, and as you can probably imagine, lots of things can potentially go wrong when there's such a complex amount of anatomy. And normally, because of the excessive range of the shoulder, it can be more at risk of injuries as we get a little bit older and weaker. So what else can go wrong with the shoulder? The majority of people with shoulder pain have either a sprain or a strain of a tendon or a muscle, and that can happen with an overuse injury. It can be an acute injury like a fall, or you feel like you've pulled your shoulder, and it can also happen over time with repetitive tasks and lack of conditioning. Frozen shoulder or adhesive capsulitis is also common, relatively, and this is a condition where the shoulder has the inability to move, and that's not a block from pain all the time. It can be an anatomical block. Osteoarthritis is another condition in the shoulder which reduces range of motion. Rotator cuff tendinosis, tendinopathies or dysfunction of those four muscles that we spoke about. Instability, dislocation or subluxation are also relatively common in departments, and we treat them all slightly differently. But if you feel like you have any questions specifically around any of those conditions, then I'd encourage you to find some reliable resources online like Physiopedia to have a look at the anatomy behind some of those specific conditions. So of those diagnoses, of course, we have lots of differing healing times, different severity of injuries, and different causes of injuries. So when you ask the question, how long will it take to get better, we're just trying to give you some generalized information here. Shoulder pain can be acute, so it can be experienced for under 6 weeks. It can be subacute, 6 to 12, or chronic, longer than 12. And 3 out of 10 adults will experience shoulder pain at any time, the majority improving within that initial first 6 weeks. So if you're one of those patients that's sitting there listening to this after 2 to 3 weeks of shoulder pain, and it seems to be just niggling away, then don't lose hope. It could easily go away within 3 weeks if you follow our advice. And even if it was to last longer than that 6 week period and become a chronic issue, it doesn't mean that it can't be treated. But we do know that if you follow the advice below, then your shoulder pain will reduce quicker. Trial and relative rest, so trying to avoid those really aggravating activities. If you know something that makes the shoulder significantly painful, or you get a sharp pain doing a particular task, then avoid that task to the same capacity. Try moving the shoulder in a different way, exercising and pacing it, and then make sure to stay on top of your medication and your pain relief. If your pain relief can give us a period of time to move the shoulder normally within, it's going to be beneficial for the shoulder joint itself. So the vicious cycle or the disuse cycle is what we use quite commonly with our patients here to contextualize the problem or try and map out the problem. And pain itself is a very complex entity, and it's not always associated with the same things that we may already believe. Now, it's true that pain is always real, but pain isn't always associated with actual tissue damage. So sometimes if our shoulder pain, for example, is up at 8s, 9s and 10s and it's really excruciating, that doesn't mean that there's something hugely wrong within the shoulder from a structural perspective or from a stability perspective. Pain can be a lot worse than the actual condition itself, and the current evidence shows us that knowing a little bit more about that and understanding pain with exercise can help reduce it in the short term and then increase your ability to move the shoulder going forwards, and therefore improving your quality of life. So although that shoulder, I'm sure, can be extremely painful, just remember that despite how painful it may be, it doesn't mean that the damage in the shoulder relates directly to the level of that pain. But once we've experienced that pain, we normally guard it, we normally rest it. So the common position for the shoulder is to have your hand in the sling position with your forearm across your tummy, and that's a normal position for us to be in when we're guarding the shoulder through different aspects. Then what happens on a physiological basis is that the muscle can spasm and sometimes inflame, and this in turn would restrict some mobility within the shoulder. And if we think about that complex anatomy, it can only take a small muscle spasm or a small bit of inflammation to significantly restrict the mobility within the shoulder joint itself. Once it's not moving correctly, we start to get some muscle wastage and some muscle weakness. When they're not being challenged, these muscles, through this big dynamic range that the shoulder is used to being used within, the muscles very quickly react and get weaker. If they're not being used, they won't be maintained at the same strength. We then start to lose some function, so you might notice that the shoulder's really stiffening up. And that just gets us frustrated. Why is my shoulder doing this now? I was only trying to pick up a watering can from the floor, or I was only trying to reach up to the top shelf, and you then experience more and more pain, and this cycle continues. As patients, the main thing that you concentrate on is the painful factor and the frustration factor. Those other things tend to go relatively unnoticed through no fault of your own, but it's important that we recognise what happens when we're resting the shoulder for too long. So the first part of the advice is not to over-rest the shoulder. Keep it moving through small ranges of motion, little bits of rotation, and there's some really nice exercises that we should have already sent out to you to allow your shoulder to do that and promote the healing factors. So is there anything that we can do to help? Physiotherapy, the idea of physiotherapy as an intervention is to assess in detail the mechanics of the shoulder, and that comes within two parts really. So we've got a subjective and an objective assessment. The subjective element is essentially just the conversation that we'll have with you at the start of the consultation, asking you detailed questions around when the pain began, what the nature of that pain is, your aggravating and easing factors, and then clearing any sinister or nasty pathologies within the shoulder with some other special questioning. Once we've got all that information down and we've got an idea of a few things that it could be in our head, gathering information, we then move to the objective assessment, which is the physical assessment. And that's when we test the shoulder's range of motion, test its strength, its ability to cope with load, and then put it in certain positions and situations to aggravate or to test certain structures, again in aiding our assessment criteria and trying to give you an accurate diagnosis. But physiotherapy is a two-way process, and you as the patient probably play an 80-20% majority role in your own recovery, because you need to be consistent with what we're asking you to do. So whenever you come into our department, please come in nice comfortable clothing that you can easily move around in, and make sure that you've got a nice clear mind about what to understand about the shoulder, and then moving forwards how to help take it on board our advice. So part of that advice will probably include education, and that's an element of what we're trying to do here. Home exercise regime is normally the best place to start, and obviously that will be tailored to your specific condition and the specific stage within your condition that you're in. But the truth of it is that moving your arm in an active way, so moving the arm yourself through different ranges of motion and rotating your shoulder through different ranges, if it's not causing you pain, you're not going to be doing it any harm whatsoever. Sometimes we'll do some hands-on treatment if we feel like it's appropriate, and occasionally we'll give you postural advice, postural tips to do alongside stretches, pain relieving medication, etc. But the important part really is we have a website for guided links on patients. A question that we hear quite commonly in department, specifically to do with shoulders, is will I have imaging on my shoulder? It's unlikely, if I'm being honest, as most shoulder conditions can be diagnosed and treated successfully through physiotherapy without the need for radiological investigations, further appointments, etc. However, depending on your specific case and depending on what information we gather from you, you may be sent for one of the following: an X-ray, an ultrasound, or an MRI scan. The reasoning behind sending you for one of those scans, again, changes on an individual basis, but more often than not, it's to have a look at the severity of the disease or the disorder that we think you may have in the shoulder, to rule out any other possibilities causing that shoulder pain, foreign bodies within the shoulder, sinister pathologies within there. And sometimes it's done after your conservative management has not been successful, which as I've said is not in the majority of cases, that is the minority. We may then look to see if there's anything more we can do, and before we do so, we'd want to make sure we had an accurate scan of the shoulder. And some of those further treatment options can include corticosteroid injections or surgical interventions. Now again, these have to be discussed on an individual basis, and they're not decisions that we take lightly, because both of these possible treatment modalities are invasive, and invasive treatment comes with a certain set of risks. So it's important that you don't think every time you come into our department we're going to inject you, and you don't think we're going to send you straight off to surgery, although that might be appropriate depending on your specific condition. But if you do have any specific questions around that, then you can get in touch with your physiotherapist directly. So the importance of general exercise. Now, what we don't want is an anatomical or physiological pain disorder to dictate the rest of your life. We still need to be getting out there and exercising and enjoying ourselves. In general, this will help to increase muscle control and strength, but more importantly, it'll tell yourself and your brain that moving the shoulder through certain ranges is still okay and relatively pain-free, but also to have the confidence that what you're doing is not going to make your problem worse. Exercise, of course, is really important for improving general fitness and mobility and helping to deal with that pain a little bit more. But most importantly, finding something that you know that your shoulder can still complete despite your current pain levels is really important. And as I said, working the shoulder through ranges that aren't too sore or painful is also vital. So the exercises that you've been sent by the department, if those exercises are too painful or causing too much aggravation, get back in contact with your physiotherapist and they'll alter and change those exercises for you. So how can we successfully manage shoulder pain? The do's and the don'ts. Do maintain a positive outlook. Make sure that you don't let the shoulder problem dictate your current quality of life. Take adequate pain medication should you feel like you need it, and that can change day to day, but make your pain relief consistent. And if you need advice on what pain relief to take, head to your local pharmacist and ask for their advice. If the pain is new and really nasty, take some initial rest, but then remember to keep that joint moving gently through non-painful or less painful movements and pace your way back up. Trial the exercises that we give you. Start small, start easy, and then gently make some progress with them, and try and make some short to mid-term goals to make progress with those exercises in terms of how many reps you're doing, how long you're doing them for, or how much weight you're using to complete them. Remember that this will keep the joint nice and lubricated and stretch the joint capsule to promote movement, but also help from a nutritional perspective within the joint itself. Stay generally active outside of your shoulder and hopefully help yourself to relieve some of the stress away from the shoulder. Use breathing techniques, mindfulness, relaxation, or head over to the Smiling Minds app on your app store to help with some of those mindfulness, to take your mind off this current shoulder issue. The don'ts. Don't completely rest it, and don't allow that disuse cycle that we looked at earlier on in the presentation to take hold. Avoid activities where you're really bracing and tensing up, and avoid those excruciatingly painful movements even in the midterm. If you know what movement's significantly painful, pushing pain 6, 7, 8, 9 out of 10, then avoid it. And don't worry, most shoulder pain improves, and if it doesn't improve straight away, that's where we're here to help you and get to the bottom of it. So persevere and be consistent. In terms of what's next, follow our advice that we've given you today. If you've not already started, try the exercises in the advice leaflet or the exercise leaflet that you've been given. They are specifically designed to help with your shoulder pain. Have a look at some additional resources as we've alluded to earlier on. If you have any questions specifically around your shoulder condition, if you're worried about anything in particular or you want some extra information, then you can always get in touch with us here in department. Thank you for listening.